All right, today we're going to talk through our IgG testing kit that we use on our foals that come into the hospital. We use this to measure the passive transfer that they get from the colostrum from the mare and to determine whether or not we need to supplement them with any more plasma to support their immune system if they didn't get the correct amount of passive transfer from that colostrum. Our different parts of the kit, we obviously have our blood that we can draw from the foal. We spin that down and use the serum from it. We use the serum and we put it into our test tube here. We have our blank that we use to calibrate the machine that measures our whole system, and then we use the results from our machine to compare to our chart here. The chart and the machine itself actually measure what's called percent transparency. So when we're looking at our chart, it tells us how much wavelength of light comes through the sample, and that correlates to a number for the foal's serum. So when we're running our system here, we obviously collect the blood, we get the serum that's spun down. We'll take a small sample out of that with our micro pipette, and it gets put into our sample tube. The sample tube has to sit for about 10 minutes to let everything equilibrate inside of the fluid to make sure we're getting an accurate measurement. Once we've done that, we come to our machine, we turn it on, we use our blank into the machine, it calibrates our machine and lets it know exactly what our base measurement is. Once that's set, we can take and put our sample in. Our machine reads our sample. It takes just a couple seconds here to get a reading once our measurement's done. And we get our percent transparency, which in this sample is about 45%. Once we get that measurement, we come over to our chart. We can find the 45% transparency and tell exactly how many milligrams per deciliter of IgG we have in this foal's blood. This sample is 1,504 milligrams per deciliter. We look for anything over 800 to be a successful passive transfer. If it's below 800, then we need to have more conversations about plasma administration and determining whether or not we need to supplement this foal to help its immune system be more effective.